You know that thyroid test report you get back from the doctor? It can look like a total jumble of letters and numbers, right? But it's actually telling a really important story about your body's energy. So over the next few minutes, we're going to decode that story together so you can understand exactly what those results mean for you. So have you ever told your doctor you're just constantly exhausted? Or maybe you're feeling anxious and wired for no good reason. You've dealt with weight changes you can't explain, or that frustrating brain fog. If any of that sounds familiar, you've probably heard your doctor say, let's check your thyroid. And that one simple blood test can hold a fascinating clue to how your body is running. Okay, so to really get this, we first need to meet the two main players in this story. Think of your thyroid gland, that little butterfly-shaped organ in your neck, as your body's engine. It's in charge of your metabolism, basically how fast you burn energy. But who tells the engine how fast to run? Well, that's the job of the pituitary gland, a tiny but super powerful control center deep inside your brain. So how does the pituitary send its orders? It uses a hormone called TSH, thyroid stimulating hormone. You can think of TSH as the volume knob for your body's energy. When the pituitary turns the TSH volume up, it's yelling at the thyroid, hey, speed up, we need more power. And when it turns it down, it's whispering, okay, let's slow things down. That go signal is the very first thing doctors look at. All right, so when we start playing detective with your health, TSH is our #1 clue. It's the most sensitive indicator of what's really going on. Before we even peek at what the thyroid itself is doing, we first listen to the instructions coming from the command center. And look, this isn't just a wild guess. This is backed up by major clinical guidelines, like the ones from the UK's National Institute for Health and Care Excellence, also known as NICE. They flat out state that the TSH test is the best place to start. It's the most powerful signal we have that something might be out of balance. Okay, now we get to the heart of it all. This is the big one, the beautiful push and pull relationship between the pituitary's signal, TSH, and the thyroid's actual hormone production. It's like a delicate dance, and once you understand the steps, decoding your results becomes so much easier. So when the thyroid gets that go signal from TSH, what does it do? Its main job is to pump out a hormone called thyroxine, or T4. This is literally the gas for your body's engine. It circulates all through your blood and tells every single cell how much energy it should be using. And we measure what's called free T4, because that's the portion that's active and ready for your body to use right now. This table right here is where it all clicks. Let's look at that first row. If your thyroid hormone, your T4, is low, meaning your engine is running super sluggish, what does the brain do? It shouts, it cranks up the TSH to try to get that thyroid to wake up. That's a classic case of primary hypothyroidism. Now look at the second row. It's the complete opposite. If your T4 is high and your engine is racing out of control, the brain does the smart thing. It whispers. It turns the TSH way down to signal, hey, slow down. That's primary hyperthyroidism. The key thing to get is that TSH and T4 usually move in opposite directions, just like a seesaw. Now, a lot of the time, the TSH and T4 results give us a pretty clear answer. But other times, the mystery is a little more complicated. And that's when we have to call in the specialists, right? Time to bring in some other tests to gather more specific clues. These are our specialist detective tools. We might check free T3, which is an even more potent hormone that can sometimes be the lone culprit in an overactive thyroid. Or, and this is a big one, we can test for antibodies. These are the real game changers. They tell us why the thyroid is acting up, and often they reveal that the body's own immune system is attacking the thyroid. Then there are other specific tests like thyroglobulin that help doctors keep a close eye on things after, say, cancer treatment. Let's actually zoom in on one of those antibodies for a second, because it's a perfect example. For Graves' disease, which is the #1 cause of an overactive thyroid, doctors look for something called thyroid-stimulating immunoglobulins, or TSI. Think of these TSI antibodies as a key that's broken off in the ignition. It's constantly telling the thyroid to go, 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 putting your whole body into overdrive. Finding these antibodies is the absolute smoking gun that confirms the diagnosis. Okay, so we've gathered all our clues. We've got the initial TSH, the follow-up T4, and maybe we even have some of those specialist antibody tests. Now it's time to put it all together and see how these numbers actually lead to a clear diagnosis and, most importantly, a plan to get you feeling better. And you know, the way doctors figure this out is actually super logical. Just like the guidelines recommend, it always starts with TSH. If that number comes back abnormal, the lab will often just automatically measure the free T4 from that same blood sample. Then your doctor interprets that push and pull pattern we talked about, that seesaw. And only if the picture still isn't clear do they bring in those specialist tests.
And usually, this path leads to one of two main diagnoses. On the left, you've got an underactive thyroid or hypothyroidism. You see the pattern. A high TSH screaming at a thyroid that's putting out low T4. The most common cause is Hashimoto's disease. And the treatment is pretty straightforward. Replace the hormone that's missing. Then, on the right, you have an overactive thyroid, hyperthyroidism. The pattern is flipped. A low TSH whispering at a thyroid that's producing way too much T4. This is typically from Graves' disease, and the goal of treatment is to slow that thyroid down.
So, we've spent all this time talking about numbers, TSH, T4, and yeah, they are incredibly important. But now we get to what is, honestly, the most important rule in this whole thing. We have to look beyond the lab report itself. This right here is the crucial takeaway. See, a lab result on its own, it's just data. It's not a diagnosis in a vacuum. A doctor has to interpret these numbers in the context of you, the patient. How are you actually feeling? What are your symptoms telling us? What other meds are you on? Are you sick with something else? All of these things can affect your thyroid hormones, and context is absolutely everything. Because at the end of the day, the goal isn't just to get a perfect number on a piece of paper. The goal is to help you feel better, right? The lab tests are an essential tool, for sure. They guide the treatment, but the final verdict is always based on the health and well-being of the actual person. We treat people, not their blood tests. So, the next time you look at that lab report, try not to just see a bunch of numbers. See them as clues. It's just a single chapter in the complex, totally unique story of your health. The real question is, what story are those numbers helping you to tell?